the ones that the paramedics give out are going to be the nasal. Has anybody seen these before? The nasal version? Real simple to use. Open the package. It actually has instructions if you can't figure out how to use it, step by step, okay, with pictures. But basically, there's no cap to take off. There's nothing to do. You're just going to stick it in your nostril, and then you're going to push. That's it. You don't push it slow. Don't push it halfway. Just push it, okay? Each one of these has 4 milligrams, okay, of Narcan in it. They come two in each box. So if you know somebody, they may have a box there. You know, if they're using, they may have overdosed and they may have gotten a box from EMS from a refusal. So if you see those, just know that they're Narcan, okay? There's 2 doses. When you find somebody, how do you know if it's an overdose? What do you think you're going to see?
Some type of paraphernalia.
Witnesses. Paraphernalia.
You may or may not see paraphernalia. It depends. It depends. It could be pills. They could have injected and then got in the vehicle and drove and then ran off the road because they passed out. That happens a lot too. So typically you may see foaming at the mouth where they're foaming. More than not, you're going to see cyanosis or blueness around the lips, the extremities, okay? Respiratory rate is going to be very slow to non-existent. Typically, probably 4 breaths per minute or less, okay? The easiest way for you to tell that is to just put your hand on their chest. If it's not going up and down, they're not breathing. Or if it's really, really slow. Also, pupils are going to be pinpoint. That's kind of hard to tell if it's light outside. You kind of just put your hands over it and look. They're going to be pinpoint. They're not going to be reactive. They're not really going to change in size. They're going to be really small. And they're going to be hard to wake up. So if you shake them and they're not moving, give them Narcan. It's not going to hurt them. Okay? If it's not an opioid-related overdose, it's not going to do anything to them. Okay? So let's say that you give him, so he's on the ground. Well, you get him face over, you know, roll him over. So you give him the Narcan. Once you give him the Narcan, roll him on his side. Okay? This is a standard recovery position. Arm's going to be out this way. Heads down. The reason for that is typically after you give Narcan, they may vomit. Okay? So do not stand over top of them when you give it. Give the Narcan from the side because you don't want to get vomited on. And then they're typically, depending on what they're using, most of the time that first dose is not going to wake them up, especially if it has fentanyl in it. Okay? But it will start to help to increase their breathing. Okay? So after about 3 minutes, if it hasn't improved, law enforcement's not there, EMS is not there, go ahead and give the second dose. Anybody ever seen a hypoglycemic diabetic when they have low blood sugar? They can kind of be all over the place, right? They're either going to be really out of it or they're going to be like they're really drunk, really crazy. Same thing with somebody that overdoses. When you give them that Narcan, you're basically getting oxygen back to their brain, right? So they're going to be groggy, foggy. You've taken away their mechanism for either getting rid of their pain, which they're in, or taking away their high. You've just cost them whatever money or whatever it is that they had to do to get that drug, and now you're standing over them and they don't know you. Okay? So just kind of keep that in mind when you do it. Put them on their side. Don't stand in front of them. And the kits that we're going to give you guys, the reason that they're doing these now is because obviously these are much cheaper. These only cost about $2 or so to make, maybe $3. Whereas these Narcan kits are roughly $75+ plus. The auto injectors are several hundred. When this first, all of them. Narcan's Narcan. It doesn't matter. The only drawback to these are that you have to take a few extra seconds to draw it up, but you have to pay attention to what you're doing. So has anybody ever drawn up anything in the needle or know how to use a syringe?
Yeah.
So you want to make sure, right, that you've got some air in it before you inject in, because if not, you're not going to get anything out of this. You have to actually push the air in and then pull back out to get the Narcan, okay? Once you do that, then you want to get it where you get the air out, and then you're just going to give it, okay? Typically, you want to do it in the thigh, okay? That's the easiest thing to do. Just give it to them in their thigh. Just grab, make sure that they don't have keys or anything in their pockets, okay? And just grab meaty part and do that. You can do it in the shoulder too if you need to, okay? Same thing.
Through the pants, through the clothes. You can do it through
Yeah.
the clothes.
Yeah, if you need to. I mean, obviously you don't want to strip somebody that you don't know out in the middle of the parking lot. So either the thigh or the arm, just make sure that you get the actual muscle part of the meat and then do it. And you're just going to get straight in. You're not going to go at an angle or anything, just straight in and then inject it. If you come across auto injectors, these actually talk to you like EpiPens.